Good morning. Today's topic is gingiva. You know what is the gingiva? It's a part of oral mucosa that covers the alveolar process jaws and surrounds the neck of the teeth. What are the clinical features for extra orally? What all do you see with gingiva? Marginal gingiva, gingival sulcus, attached gingiva, and the internal gingiva. Coming to what is marginal gingiva, it's also called unattached gingiva. It's the terminal edge or the border of gingiva surrounding the teeth in a cord-like fashion. It is demarcated from the adjacent attached gingiva by shallow linear depression. That's called the free gingival groove. It forms the gingival sulcus. Gingival sulcus is a shallow crevice or the space around the teeth bounded by the surface of the tooth on one side and the epithelial lining on the other side with the free gingival margin on the either side. So clinically, it's around 2 to 3 millimeter in depth, and histologically, it's considered as 1.5 to 1.8. But ideally, it will be the sulcus depth is 0. Figure shows where the exactly what is the gingiva. This is the free gingiva, where the exactly it's demarcated from the adjacent, the attached gingiva. From that's called free gingival groove, which is the separating, demarcating line between the marginal gingiva or the free or unattached gingiva from the attached gingiva. Here it shows the sulcus depth. It will be either probe is introduced or probed in that area. We'll be getting how much is the depth of the sulcus. Usually it will be clinically it will be considered as 2 to 3 millimeter, and histologically it will be considered as 1.8 millimeter. Coming to what is attached gingiva, it is a firm and resilient and tightly bound to the underlying periostem. It is demarcated from the movable alveolar mucosa by mucogingival junction. It's a white silvery line which is demarcating from the movable tissue from the unmovable or the attached area. From that demarcating line, the silvery line or the mucogingival junction to the free gingival groove, it is considered as the attached gingiva. How will you measure the width of attached gingiva? The distance between the mucogingival junction and the projection of the external surface of the bottom of the gingival surface of the periodontal pocket. Usually, the width of attached gingiva is greatest in the incisor region, that is 3.5 to 4.5 millimeter in the maxilla, and 3.3 to 3.9 in mandible, and narrower in the posterior region, that is around 1.9 in the maxillary and 1.8 in the mandibular region. That is the normal dimension of the attached gingiva. How will you measure the attached gingiva? Attached gingiva is measured from the marginal gingiva to the first you measure the depth of the sulcus. Then you measure from the marginal gingiva, the margin of the gingiva, to the external surface, which demarcates the attached gingiva from the movable tissue. That is called mucogingival line. From that thing, you minus the gingival sulcus, you will get the value. That is called the clinical method of measurement of attached gingiva. First, you measure the gingival sulcus, then you measure the depth from the marginal gingiva to the white silvery line which demarcate the movable tissue and the attached tissue. That is called mucogingival junction. From that thing, you minus the gingival sulcus, you will get the value. That is the clinical method of measurement of attached gingiva. Other methods are Schiller's potassium iodide test, tension test, and the roll test. These all other things also used to measure the width of attached gingiva. This is the anatomical landmark of the gingiva. See the gingival sulcus, which is separated. From the one side it is tooth and the other side is the gingival tissue. Then the free gingiva, where it is demarcated from the attached gingiva by a depression that's called the marginal groove or the free gingival groove. Then the mucogingival line or the junction which separates the movable tissue and the attached tissue. That is the free gingival groove to the mucogingival junction. It's considered as the attached gingiva. Coming to what is the internal gingiva? They usually occupy the gingival embration. This is a contact point between the below the contact point and the crest of the alveolar bar, which interproximal surface below the tooth contact can be pyramidal or cold, which is the valley-like. What is cold means the valley-like depression that connects the facial and the lingual papilla and conforms the shape of the interproximal contact. In case of the anterior, the labial surface, it will be the pyramidal, and in case of the internal area, it will be valley-like depression. It's called cold. The lateral bone and tips of the internal papilla are formed by the continuation of the margin gingiva and intervening portion of the attached gingiva. The shape of internal papilla depends on the contact point as well as the presence of some degree of recession. In case of recession, if there is no tooth is absent, if there is a spacing between the tooth, it will completely, there is no internal gingiva in that area. See that is a pyramidal in shape. In case of spacing, there is no. But in case where there is a internal gingiva that connects the facial and lingual surface, you will get a valley-like depression. That's called the fold. Coming to the microscopic features of gingiva. The oral epithelium is divided into, or the gingival in the oral epithelium is divided into three. That's the outer oral epithelium, that's the keratinized epithelium, the sulcular epithelium, which surrounds the sulcus, and the junctional epithelium, which is the connecting the tooth with the soft tissue. That's again normally it will be non-keratinized. What are the cellular elements of gingiva? It contains keratinized epithelium. The principal cell structure is the keratinocytes, which can synthesize keratin. Other cells found in the epithelium are the clear cells, all the non-keratinocytes, which includes Langerhans cells, Merkel cells, and the melanocytes. Coming to the gingival epithelium. What are the functions of the gingival epithelium? It's the first oral tissue to form a barrier to the inflammation by mechanical, chemical, water, and the microbial. It's the first line of defense. The main function of the gingival epithelium is to protect the deep structure, which is achieved by the proliferation of and differentiation of the keratinocytes. It's also called the keratinization. That's a cell which travels from the basal layer to the superficial layer. Also have the signaling function by playing an active role in the host defense mechanism. Proliferation takes place by the mitosis in the basal layer and less frequently in the superficial or suprabasal layers. A complete keratinization, the process is called orthokeratized epithelium, which has no nuclei in the stratum, corneum and a well-defined stratum granulosum. But in case of parakeratized epithelium, the stratum corneum retains the epinotic nuclei and the keratohyalin granules are dispersed, not giving rise to stratum granulosum. The non-keratinized epithelium has neither the granulosum nor the corneum, whereas superficial cells are viable nuclei. Here shows the 4 layers of the epithelium. The lower bottom or the basal layer. The second layer is called the prickle cell layer. The third granular layer and the superficial layer. In case of keratinized epithelium, the 4 layers will be there.